Good afternoon. My name is Dr. Ali, and today is our topic about the pathophysiology of external breathing, like hypoxia. So, first of all, what is the respiratory insufficiency? Respiratory insufficiency. So, respiratory insufficiency is such a pathological state when tension oxygen in blood arterial is reduced and the tension of CO2 exceed to 50 mmHg. So in most cases, it is just characteristics of the respiratory insufficiency is degree of the arterial hypoxemia. So like many of the specialty as respiratory insufficiency also such state when it is respiratory parameter of the blood are within the physiological variation. So this is the some kind of anatomical structure of the physio, like the respiratory system, means the lungs, the bronchiole, the alveoli, the capillaries, arteries, veins of the lungs. This is the bronchiole, and this is the inhalation, the movement of diaphragm, and the movement of diaphragm in the exhalation. So forms of respiratory insufficiency, like it is acute respiratory insufficiency and it is chronic respiratory insufficiency. In acute respiratory insufficiency, it is a certain kind of state when the syndrome develops fast, within minutes of hours or a day, or has tendency to progress. Like if I have to talk about that, what kind of condition in which it is arterial hypoxemia, hypercapnia, and develops acidosis. There are disorders, CNS. All these completed at coma. All these are completed at coma and the death. So, like asphyxia is the state of standing of life, which blood does not enter into the oxygen, and the from blood the carbonic gas is not removed. Like it is the presence of the larynx, the presence of respiratory, swelling of the lungs, a double type of the pneumothorax, strong oppression, external compression of the airways. Everything is included in the asphyxia. So there are three periods or three courses of the asphyxia. Like the first period is the excitation of the respiratory center. Means the respiratory center or the cardiac rate or any kind of arterial pressure is increased. After that, the second period is the asphyxia is characterized by the predominance of parasympathetic nervous system (PNS). So it includes like breathe, cardiac rate decreases, arterial pressure decreases. In third period, oppression of both frequency and the depth of the breath. Breathe. So breathe temporarily stopped. On the background of the stop, there is something single mode or low respiratory movements. So after that, we will talk about the chronic respiratory insufficiency. It is characterized by the slower increase of hypoxemia and the hypercapnia, and they do not reach such degree as acute insufficiency due to inclusion of the compensatory mechanism, like like erythrocytosis, increase of the hemoglobin in the erythrocytes. So most of them is also known as the external breath is provide the like the three process, the ventilation or ventilating lung, diffusion of the gases through the alveolar wall, or perfusion of the blood through the lung capillaries. So in pathogenesis, it is distinguished between two forms of respiratory infection, ventilatory and the alveolar respiratory. So, like if we talk about the pathogenetic classification of the respiratory insufficiency, it is ventilative, diffusive, perfusive, and combined. In ventilative respiratory insufficiency, it is obstruction, like restriction, and dysregulation means the dysregulative, like the disorder of the C central regulation of the breath. In the ventilative respiratory insufficiency, it is the sense of ventilative insufficiency in that in alveolar of the units time enter less air than in norms. The state is called the alveolar hyperventilation. So it is also that is one of the respiratory center function. Effect of medical drugs, the cerebral brain traumas, malignant tumors, abscess of the brain meningitis, disorder of the brain circulation. So after the ventilative respiratory insufficiency, some kind of disorder includes innervation of the breathing muscles and limitation of the thorax mobility and disorder of the thorax integrity and the pleural cavity, like pneumothorax. So like OS, yani obstructive insufficiency. It is the obstruction of the respiratory ways in which the narrowing of the lumen and increase of the resistance of to movement of air. The damage can be located in the upper respiratory ways, like 2 meters of or above, and in the and in the lower respiratory ways, the diameter is up to the 2 millimeter. Obstruction of respiratory insufficiency include the upper respiratory ways, obstruction of the internal and external mechanical trauma, like internal trauma, like it is complication of trachea, intubation after the operation on the larynges, external mechanical trauma, like lower the cervical cartilage ranges, cartilage, epiglottis, etc. And the mechanism of obstruction include the spasm, edema, paralysis of the voice slot, damage of the larynges, cartilage, hematoma, edema of the mucous membrane, and the surrounding tissues. So, like, if we talk about the internal trauma, like it is the burns or inhalation of the poisonous gases, bleeding in the respiratory ways, like from nose or the neck injury after the neck injury, aspiration of the foreign body, like the children in the age of the 6 months or 4 year more often happen in the aspiration of the foreign body, obstruction of the lower respiratory ways, like angina and like the subpharyngeal abscess, like asthma, rhinitis, natal rash, etc. Obstruction of the lower respiratory ways include the liquid aspiration, vomit mass, or blood water. Allergy response mainly on the medical preparation, antibiotics, and the protein substitutes. It develops immediately after 30 minutes, during 30 minutes, and appears hardly expressed to the laryngeo and bronchospasm. So it is a ORI, obstructive respiratory insufficiency. It is include the chronic unspecific disease of lung, chronic bronchitis, emphysema, bronchiectasis, bronchial asthma. So emphysema is the illness in which rupture of intravalvular septums, lungs, and capillaries. By basis, it's considered degraded collagen and elastin fiber of the proteolytic enzymes which are produced phagocytes under the influence of the external air, microorganism, dust particles, and tobacco smoke. The mechanism of the obstruction is due to when bronchioles or when anything wall of the bronchioles is very thin and pliable, and the lumen is then supported the transmolaris more pressure. So this time it is like the decrease of the lumen conducts a sharp increase of the resistance movement of the air as a result of the breath is a difficulty, but even more exhalation is also difficult. For what the emphysema, it becomes more active. So from outside of the lungs fabric, with the course of the time, the bronchioles compress completely and exhalation become impossible, all because air becomes isolated in the alveoles. So this is the mechanism of the emphysema or due to emphysema. So the mechanism of obstruction due to bronchial asthma, like accumulation of viscous gases in the mucus of bronchus, like the viscous mucus is difficult to discharge and congest, like like mucostasis. The important role of the mechanism of the mucostasis plays the hyperplasia, goblet cell, and the substitute cell of the ciliated epithelium. So it is due to the edema of the mucus, spasm of the smooth bronchus muscle, and increased activity of bronchial muscle on the specific and unspecific stimulus. And after that, the restrictive insufficiency. This form of the respiratory insufficiency arises when the extensibility is largely reduced, and that is when it is not capable to easily to be straightened. So to carry out a breathe, it is necessary to increase the transpiratory pressure and can be made at the expense of the increase in the respiratory muscle action. So RI restrictive insufficiency. It is due to inflammation and the lung edema, arterial venous and hyperemia and swelling of the interstitial tissue. Alveoles is compressed and the outside and the completely are not straightened. So lung fibrose, that is a growth upper of the fibrous connective tissues on which the perished elements of the parenchyma, elastics, fibers, and capillaries, and the disturbance of the like the system that are present on the surfactant system. So the deficiency of the surfactant which include the insufficiency of synthesis of the excessive remove from the surface of the alveoles, like the insufficient synthesis of the characterized by illness and hyaline Like acquired disease of the surfactant is observed due to the asphyxia, acidosis, pneumonia, pollution of the air. And it is also like the atelectasis follow the alveolar stopping of their ventilation, pneumothorax, deformation of thorax, paralysis of the respiratory muscles. So after that, it is the dysregulation of the respiratory insufficiency. So respiratory center dysfunction in hypoxia, hypoglycemia, brain tumor, a brain trauma, uh, a brain trauma, a compression like edema, tumor, or hematoma, a disorder of the brain circulation, intoxication like narcotic, muscarine, toxic metabolic product, inflammation and dystrophy, and disorder of the impulse transmission to the respiratory muscles. It will be followed as when any kind of nerve is damaged. That is bad to the respiratory muscles. So disorder of the central regulation of the breathe like influence of the reflex and the humoral factor and the direct influence of the respiratory center changes function. Those disorder of the breath regulation which limit alveolar ventilation can serve as the reason of respiratory insufficiency. So like a pre-disturbance of the central genesis like a bradypnea, like it is a rare breed, it can rise, it will actually cause arterial pressure increase, and also due to the hyperoxia, not hypoxia. So the deep and the rare breeze rises due to narrowing of the upper respiratory, which is named as stenotic. The reason of the bradypnea is that region of the neurons of the respiratory center due to the long time of hypoxia under the influence of the narcotic or a functional disorder of the central nervous system. So, like tachypnea, frequent surface breath is rises reflexive in fever, hysteria, pain of the area of the thorax, peritoneum, and the pleura. Hyperapnea means deep and frequent breath, like it is a character, however, excessive stimulation of the respiratory center in pathological condition, and provoke the rather intensive breath, which can lead to the removal of CO2 from the organism and paralysis of the respiratory center. Apnea is the temporary stopping of the breath, the manifestation of the inhibition of the neurons of the respiratory center under the influence of the hypoxia and intoxication, owing to the organic lesion of the brain, like in blood, drop level, threshold of the respiratory center of the level, and after during the rise of the arterial pressure. Periodic breathing, this is the such kind of respiratory rhythm which the period of the respiratory movements alternate with the period of the apnea. There are two main types of the periodic breath, like the chain strokes and the biots. In the first case, amplitude of the respiratory movement cyclic is increased up to the express hyperapnea and decreases to the apnea. Owing to the biots health, amplitude of the respiratory is constant. In chain strokes, it means the expressed hyperapnea is increased from hyperapnea and decreases to the apnea, but in the biots it remains constant. Dyspnea. Dyspnea is the sensation of the air lack and stimulation is necessary to the strengthen of the breath. Insufficient oxygenation of the blood in lung, like the lower partial pressure of the lung is inhaled, difficulty of the ventilation of the lung, of the hemodynamics, disorder of the gases transport and blood insufficiency, like metabolic acidosis and the functional and organic lesion of the brain. So diffuse respiratory insufficiency includes the decrease of the area of the alveolar capillary membrane, thickening of the capillary membrane, decrease of the transmembrane, decrease of the volume of the capillary, decrease of the speed of the reaction between the O2 and Hb, and the oxygen capacity of blood, decrease of the. It is too much easy. If you think about this, how is that future respiratory system will work? Ultimately, you will as a medical student, you will know about the decrease of the alveolar ventilation, decrease of the exposition and contact of the rhizocytes with the alveolar rate. Simple as that. Pathological process connected with the disorder diffuse in lung, damage of the membranes, inflammation and accumulation of the sclerosis, fibrosis, edema, anemia, emphysema, cardiac insufficiency, alveolar respiratory insufficiency, like the type of respiratory insufficiency arises in that case when it reduced gases exchange between the alveolar and the air. There are two main variants of the insufficiency due to inadequacy of the ventilation of perfusion of the lung down to the difficulty of diffusion of the gases through the alveolar wall. Hypoxia means it is a typical pathological process which arises due to the insufficiency of oxygen. Simple, as maybe some of you is now about the hypoxia because it is the insufficient oxygen supply to the tissues or insufficient use it's by the tissues like hypoxia, hemic, circulatory, hysterotoxic. Hypoxia, essence of the hypoxia is oxygen tension reducing in the arterial blood, hemoglobin saturation with the oxygen decrease as a result of content of oxygen is decreased. Thus, hypoxia measurable. Decrease of the partial oxygen pressure in inhaled main reason of oxygen tension reducing the blood. The second one is the hypoxia. Hypoxia is the several respiratory insufficiency which arises as a result of the external breath center. So ventilation and diffusion is and perfusion. So in the result of these cases, alveolar hyperventilation includes the pressure of the respiratory centers, obstruction of the air passages like thorax damage, and disease of the respiratory muscle and the intercostal nerves. Hypoxia, basic of the hypoxia type is decrease of the blood oxygen, and there are two variants like anemic and toxic. In case of anemic form, the total level of the circulating hemoglobin decreases owing to the blood loss, erythrocytes, hemolysis, oppression of the blood formation. The toxic form arises in case of the hemic toxins like poisoning. The general content of hemoglobin remains normal, but the content of the functionally active hemoglobin decreases. So that's why the part of the hemoglobin turns into such a way in such compounds which are not capable of execute of the oxygen transport function. So the circulatory hypoxia means it is a such kind of hypoxia which is stimulated or stimulated by the circulation of blood speed decreases. That is the oxygen delivery means when the delivery of the blood is decreases, ultimately the amount of oxygen is also a decrease because we know the oxygen is bind to the blood or hemoglobin of the blood. So it is related to the general blood flow like the slowing in the cardiovascular insufficiency or to the local blood supply disorders. In histotoxic, it is due in the histotoxic hypoxia. It is mainly due to the tissue's inability to oxygen utilizing. Means tissue cannot use to utilize the oxygen. The main index is the lower arterial venous difference. Neither the content of the oxygen in blood nor is the delivery to the tissues are not considered. The reason of the this hypoxia is decrease of respiratory enzyme activity. Mechanism include there are three enzymic systems like the pyridine dependent, flavin dependent, and cytochrome dehydrogenase. Two of them are dehydrogenase and third one is the cytochrome. I'm sorry. Any of these system blockade will result in the disorder of the electron transport throughout on a respiratory chain and will cause histotoxic hypoxia. This is the aerobic respiration overview. Like you know, the glucose by the glycolysis convert into the pyruvate. After that, the lactate, and then the acetyl coenzyme A is help in out to move out to the Krebs cycle. After that, after the Krebs cycle, like the electron chain transport, and we get our ATPs in the form of ATPs. Like 38 ATPs are produced at the end of this process. This is again the simple form or simple explanation of this all the process. Like a metabolic wind state in hypoxia feature of the protein metabolism disorder, inhibition of the synthesis of the simultaneously acetylation of the fibers, disintegration, increase residual blood nitrogen content, and ammonia accumulation. The ATP decreases in the cell and underlie of hypoxia damaging effect upon the organism, like the macrogenic compound carbohydrate metabolism and the fat metabolism. Like in cerebral and heart activity disorder in state of hypoxia, like nervous system, the brain cortex neurons can work perfectly in condition of complete blood flow, but for 5 to 6 minutes, oblongata brain neurons maintain the complete blood supply, terminate 20 to 30 minutes, spinal cord neurons up to 60 minutes. It is very important for the in the from examination point of view. So the macron is very sensitive to the Myocardium means the muscle of heart. It's very sensitive to the oxygen starvation. It takes the second to place after the nervous system, increasing the heavy hypoxia, oppresses the contract of rhythmic heart activity. It is due to the inhibition of the oxidation and the energy deficiency. The compensatory responses in state of hypoxia like the respiratory, hemodynamic, bloodly, and the The respiratory response appear to be a dyspnea, which is accelerated by the deepening of the breath. It is named as the high altitude or hypoxic or compensatory. Because dyspnea rises to play in the homoreceptors aortic arc and the synocarotid zone. Synocarotid zone, which includes the baroreceptors, like the pressure receptors, which maintain the blood pressure and the regulation of the, I think, the blood flow. The hemodynamic compensatory response include the tachycardia, the result of the sympathetic tonus in the increase. The stop blood volume increases at the expense of the adrenal inaction upon the myocardium or adrenal receptors. Cardiac output increases at the result of tachycardia, and stroke volume increases. The blood flow acetylation and the blood circulation centralization, that is peripheral vessels, nerving, and the vessels of the vital organs. Bloodly compensatory response like the erythrocytosis, the increase of the hemoglobin in erythrocytes, the increase of the hemoglobin affinity of oxygen in the lung, and the tissue compensatory response, and the degrees of the metabolism, activation of glycolysis, activation of the respiratory chain enzymes. All the enzymes will activate in this process. Adaptation of the hypoxia, like hypoxia is not only damaging, but it is also training factor during the hypoxia. Training period adaptation is formed first. In case of long hypoxia, certain made emergency adaptation turns into a long-term adaptation arise because it takes more time to adopt this kind of situation. Adapted organisms spend very economically energetic and plastic resources. Thank you so much for your concentration. Hope we'll be meet in another session with a new topic. So stay tuned. Take care.